Today we're joined by Nick Dahl, who's our 8th LDN specialist. Thank you for joining us today, Nick.
No, you're welcome. It's a pleasure to be here.
Could you tell me why you took the course?
So for about 2 years now, I've been doing nothing but telemedicine work. So I don't have a brick and mortar practice. I see patients online. In March of this year, I started working for a company called Ageless RX, and they prescribed low-dose naltrexone, and I had never heard of using it that way. The medical director trained me. He recommended that I take the course, and it was very informative. It's amazing the stuff. I graduated residency in 2011, and it's amazing the science that has come out since then that I would have missed otherwise, especially in this field. I treated lots of patients with chronic inflammatory diseases. I had a brick and mortar office, and I can imagine if I had it and I had known about LDN and used it, I would have been more successful with a lot of those patients.
These prescribers with telemedicine become more expert in the niche condition.
Oh, for sure. Yeah, and we have some patients that will straight say that. They'll say either my doctor wasn't very comfortable with it, or my doctor just said, no, I don't know anything about it, so I'm not going to prescribe it. Some doctors will, but the patient's like the only patient they have that they do that, so they don't really know that much about it. And there is some sort of nuances to treating patients with LDN, because it's not like with OxyContin for pain, it's just a hammer. You just keep cranking the dose up. But with LDN, it's not really the best way to do it.
Mm-hmm.
There's definitely a learning curve, and like you say, you have to treat a fair number of patients. And even in a small practice, there's only a subset of your patients that LDN are going to be appropriate for. So you're going to have a small number anyway, unless you're sort of a specialist in that area and people here and you live in a city and all this. But telemedicine, yeah, you can. I've gained a lot of experience in the just under a year that I've been using it.
Mm-hmm. Well, congratulations on passing, and thank you very much for having joined us today.
Oh, you're most welcome.